I can officially confirm that Australia has now passed the 70% double-dosed vaccination rate.
We're going to be among the most vaccinated communities anywhere in the world.
In terms of the booster recommendations, ATAGI is currently considering the recommendations, and I understand that they will be releasing that very, very shortly.
Australians have been magnificent with vaccination, and we're predicted to reach more than 90% coverage of those aged over 12. But this pandemic is unbelievably frustrating. Just as you reach the top of one hill, another rises above you. The next challenge is waning immunity, which in Australia is becoming significant pretty much now.
We've now seen a number of studies on a number of vaccines from a number of different countries, all of which are showing the same thing, that by about 6 months, maybe even as early as 5 months, the vaccines start to wane. It was thought that it didn't affect the risk of hospitalisation and death. That seemed to hold for the first few months, but now, with longer follow-up, it's clear that even the effectiveness against hospitalisation and death starts to wane.
And since our vaccine rollout, which started in March, was by priority groups, they are again at the front line when it comes to waning immunity.
The tricky part is that the most vulnerable and the people at highest occupational risk of infection were vaccinated in phase 1A, and that includes aged care residents and staff and healthcare workers. So they will be most at risk of the waning now, and I feel it's quite urgent to be looking at the issue of a third dose for those groups.
Certainly the opening up in New South Wales and Victoria, there is a level of concern within the sector. We've done everything we can to have the protections in place in the current set of circumstances, but as those circumstances change, we need to be able to move quickly in response.
The peak body for the aged care sector has flagged its concerns to state and federal governments.
Well, what we put forward is a discussion paper to governments with respect to here are all the arising issues as we come out of lockdowns, and also as we seek to live with COVID in the community. The issue around booster shots or waning effectiveness of vaccinations, as well as ongoing vaccinations for aged care workers, are right up there. It's important to give confidence to residents and their families, and also for our staff.
As we open up, case numbers are expected to rise. And while most of us are recently vaccinated, healthcare workers who got the jab early could be vulnerable.
Most of the high-level data that we've seen is still supportive of the fact that these vaccines are providing protection against hospitalisation and death. But of course, with the waning immunity levels, we are concerned that as more time goes on, that protection for anyone who's been vaccinated against hospitalisation and death may also wane. And of course, we don't want to find out the hard way by seeing nurses and doctors at the front line getting infected, ending up in hospital, or even worse, ending up in ICU.
The federal government has accepted for some time that third doses are inevitable. They've already started with people whose immune systems are compromised and, like Dr. Khorshid, says supply isn't an issue.
As vaccines become available towards the end of this year, we're going to have plenty of vaccine available for these third doses. It is absolutely critical that those whose immunity may be waning are afforded that third dose availability.
But how will that be done? Because the rollout didn't work very well first time around, at least in aged care.
We've learned a lot of lessons, and certainly there was frustration and confusion and disappointment with the early stages of the rollout of the vaccinations for aged care residents, and also frustrations for aged care staff. But we have learned a lot, certainly through that process. I'd be looking to advise the government that we need to go back to the systems that we know that work.
I think it needs to be done now, or we're going to see, increasing outbreaks in aged care facilities. There's actually over 70 active outbreaks at the moment, of one case or more across New South Wales, Victoria and the ACT in aged care facilities right now, and over 300 cases in aged care.
Earlier today, the Health Minister, Greg Hunt, says he hopes to roll out third doses in aged care from November. but the regulator will have to approve the use of booster shots first.
We're ready. We're in a position to commence and to make sure that additional protection is provided.
It's important to remember that double-dose vaccination gives good protection. And for most of us, we've plenty of time before we'll need a third dose.
Actually, we've achieved an enormous amount as a community, and I think we need to be thankful for that to all those people who run the community vaccination centres. And I think with that same attitude, I'm really confident that our booster program will roll out fast once it's been announced, and will continue to protect the community.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.